Okay, so welcome to this hip and groin examination. So I've got Jonathan with me today to help out. Is it okay if we examine your hip and groin today, yes. Jonathan? That's great. Okay, so with any hip and lower limb examination, I like to start with gait. So we're a bit limited in this small space, but just take a few steps towards the door and then back for me. So just looking at the gait to observe any obvious antalgia or asymmetry or problems with the gait and weakness. And then like to do a quick power screen, which can be looked at more closely later. So simply just going up on the toes for me, and then back on the heels. So if they're able to do that, then that sort of gracefully assists the power is probably fine. And equally, if there's any abnormality in that, you can examine that more closely later. And then let's have a look at the back. So if we're just on the side view for me there. So you're just looking at the back. Is there a normal alignment? Is there a normal lumbar and cervical lordosis and thoracic kyphosis? Looking for any asymmetry or wasting at the back. And if we just do a few functional tests, so as you stand there, if you just go up on one leg for me, and then repeat on the other side. Just a single leg stand, so that actually is a good assessment of balance and control around the pelvis, but it also drops up as a Trendelenburg test. So if there's a hip drop on the lifted leg compared to the stance leg, that might indicate a gluteal dysfunction or osteoarthritis in the stance leg. We then progress that further to a single leg squat, so just go up on one and then just down for me again. Okay, so you're just looking for deviation of the standing knee, and again, sort of lumbar pelvic control there. That's fine. And a further progression of that would be a single leg extension. So just go back onto one leg for me, and then just come back as much as you can, just extending the back there and back. That just puts pressure on just repeat that. Puts pressure on the posterior structures, the spine, and may give you pain unilaterally in a stance leg with a pars defect. Another thing you can do whilst we're in this standing position is to look at the sacroiliac joints. So if we lift these up, you find the posterior superior iliac spines, work medially to that. That should be the SIJ around level S2. And again, if you just stand on one leg for me, so that's fine. And in the normal SIJ, there will be a drop of 2 centimetres on the leg that is lifted. If the SIJ is inflamed or blocked or fused, then there won't be any movement at all. Okay, so I then like to go on to having a look at the back. So if I just pop you on the bed there, that's fine. Okay, that's fine. So again, just further clearing the spine. So I'll just ask you to lift your leg straight up for me. Just a straight leg raise. Is there any pain there? You might give sciatic pain going down the back of the leg. You can also ask at this point where the site of the hip pain is. Anterior or groin pain tends to indicate an intra-articular problem. Lateral pain may indicate greater trochanter issues, and posterior pain again might be sciatica or piriformis or a gluteal tendinopathy. We then go on to palpate the structures around the pelvis. So just the anterior superior iliac spine, moving medially to the pubic rami and the pubic bone in the middle, asking if there's any tenderness there. Move over to the great trochanter. Bilaterally, if there's any tenderness there. And again, posteriorly, you can press in the inferior gluteal region for any gluteal tendinopathy, and also for any piriformis or sciatic pain. We then go on to some some range of movement. So we've already seen our straight leg raise, which is knee flexion, so we just go up again for me, just with a straight leg, that's fine. Up as much as you can. That's it, okay. And then that's it, and flex the hip there. So it's internal, external rotation. Abduction of the hip. And then finally, abduction, so if you push the non-examining leg across and just move across, it gives a good idea of hip abduction there. And then if we move you on to your front for me, we now assess hip extension. So just bring, if you just that for me, just lift up, give an idea of the hip extension, do that both sides. That's fine. Okay. We can then move on to some manual muscle testing to test some of the muscles that work across the hip. So while we have Jonathan in a prone position, we can just ask him to lift his leg up against my hand and push down. That gives an idea of hamstring strength. And you just bend up for me there and just pull me towards you. That's more gluteal. Same goes on this side. So it's just straight leg, sorry. So hamstring and bend. And just pull me towards you, that's fine. And if you go onto your front for me. So again, just lift your leg up against my, just testing hip flexion. And again, that's fine. And you bend just to 90 degrees and pull me up towards you. With your knee, sorry. So if I pull you away. Oh. So that's predominantly LSOS function, the same this side. So that's fine. You push out against me, so hip abduction. Adduction and abduction, which is more gluteal, and just pushing against me. That's fine, that's just adductor strength. And finally, you can assess sartorius, which acts across the pelvis and knee by flexing the hip and knee and placing the heel on the just below the knee of the non-examining leg, and just pull away, just resist me, pull away that heel. That's fine. Something we should do whilst we're here is just to assess neurovascular function. So just feeling the pulses. Gross sensation, is that normal? Mm-hmm. Yeah. That's fine. And if you detected any power problems previously, that can be further examined here together with tendon reflexes, S1-2, L3-4, the knee. Then we can go on to some special tests. We've already done some of these with some of the manual muscle testing, but there might be some repetition here. Essentially, we're looking for extra-articular and intra-articular problems around the hip, as well as groin pathologies. So, in terms of the sacroiliac joint, we've already examined this at the back, and a further test that can be done for this is the flexion, abduction and external rotation test. So just knee rested across here for me. This also doubles up to a good range of movement of the hip. So examining the right hip here. So with pressure on the contralateral anterior superior iliac spine, just apply some gentle pressure on the flexed leg. And the leg should be, you should be able to achieve level with the non-examining leg. If there's pain reported in the SIJ region, that might indicate a sacroiliac problem. A further test for sacroiliac joint is a lateral compression test. So just get you to lie on this side for me. And you simply just press on the iliac crest and provide compression, again causing pain in the SIJ region. Okay, just that. But then another structure that can be examined is the piriformis. So good test for this is hyperreduction and external rotation. And that might give pain in the gluteal region, which may be a piriformis problem. And another pathology you don't want to miss is a stress fracture of the neck of femur. If there's a gross neck of femur fracture, that one should be obvious with sort of limited gait and an externally rotated and shortened leg. But for more subtle fractures, simple percussion can sometimes give a clue to a fracture. So percussing down the tibia and the leg. You can also do this at the knee and directly over the greater trochanter. Okay. Next, you want to assess the tensor fasciolata and the IT band. And you can do this in side lines. So if you just lie again on that side for me. So if there's patient reports a snappy hip, this can often be seen simply by pulling the hip into extension, and the IT band can be seen flicking over the greater trochanter there, causing a click and sometimes pain. That also is an Ober's test, where the hip is extended and then gently rotated. Just flexioning there for me. And again, that might provoke that clicking sensation. If you just lie on your back for me. So again, another clicking snapping hip problem can be due to the iliopsoas, and that can be assessed in a number of ways. First test can be the Thomas test. So I'll just get you to hold both your knees into your chest for me. So and then just grab them for me. Just hold your knees.
Oh,
that's it. And then for the hip you're examining, you can just ask them to release this leg, and then just let that go. So keep that one up, and then just looking. With a tight iliopsoas, there may be a fixed flexion deformity of the hip there against the bed. Okay, that's fine. The further examination of the iliopsoas is to flex the hip and internally rotate whilst pressing on the groin, extending and bringing the hip into internal rotation from external rotation. We just do that against the flexion, external rotation, extension, internal rotation. And again, you may be able to feel the iliopsoas clicking over the anterior capsule there in the snappy hip. Next is intra-articular pathology such as labral tear. The idea here is to pinch the dysfunctional labrum in the acetabular rim. This can, in a particularly bad labral tear, this can be simply achieved by a log roll. So just rolling the hip, so internally and externally rotate within the joint, and that can be enough, although it's not particularly sensitive. A further test to aggravate this is again to sort of hyperflex the hip and internally and externally rotate in flexion, and that can cause pain. Another intra-articular pathology is thoracotabular impingement, and this is particularly exacerbated with internal rotation manoeuvres. So we can do the FADA test, which is flexing the knee to 90 degrees, internally rotating, and then providing some hip adduction. And that often gives pain in the anterior hip. Finally, in those complaining of groin pain or pubic pain, you can perform a squeeze test, which may exacerbate pubic-related groin pain. So I'll just ask you to flex your knees and bring that forward, and just squeeze my fist there. The patient may report some pain there in the groin. That concludes the examination.